I hope you can hear me and I hope you can see me. Welcome to this webinar. Thank you so much for joining us today. My name is Marion Otieno. I'm the Programs Assistant, Reculture, Health and Social Innovation. The purpose as to why we are here today is to commemorate Cervical Cancer Awareness Month. January is Cervical Cancer Awareness Month. And today in this webinar, we are going to focus on demystifying narratives around HPV vaccine. So today we'll be having our speaker, Dr. Karen Muthembwa, who will also be joined by her colleague, Dr. Kohe Alexander. Just a few introductory remarks before we begin. We know that cervical cancer is one of the leading cancers causing death in Kenya, that is after breast cancer. And yet it is one of the most preventable and treatable cancers when detected early. So one of the things that we see leading to death is now that we're losing almost 9 women daily in Kenya due to cervical cancer is because of vaccine hesitancy. HPV vaccine hesitancy usually propagated due to myths and misinformation and also lack of acceptance from religious groups, parents. So today we want to debunk these myths and misinformation so that we can attain the 90-70-90 WHO targets, which states that at least by 2030, 90% of girls aged between 9 to 15 years will have been vaccinated, and also 70% of women will be screened via high performance tests, and 90% of women diagnosed with cervical cancer will have been treated. So this is at least one of the cancers that has been marked for elimination by the WHO. So just to start us off, I'll welcome Michelle Mayuba, my colleague, to give us a brief about the work we do at Reculture, Health and Social Innovation for those who are not acquainted with the work that we do. Michelle, welcome. Michelle, are you around? So let's just give her a few minutes. Seems like Michelle is having a bit of technical hitches. So I'll take you through a little through our profile. So a bit of a background on Reculture. Please let me know if you're able to see my screen. So Reculture first began in 2017, and it is a social enterprise that is committed to improving access to quality healthcare services and also promoting human capital development. Mostly we work with youth and youth-led organizations to be able to accomplish our vision and mission. So our mission is to build sustainable, healthy, and prosperous societies through nurturing competent and socially responsible individuals and building resilient, sustainable pharmaceutical systems. And our vision is, of course, a healthy, socially responsible, and prosperous society. So I will skip about our journey. You'll be able to receive these slides at the end of the webinar. Mostly our work is centered around health advocacy, or rather health system strengthening, majorly in for health system strengthening, we deal with sexual and reproductive health, neglected tropical diseases, and non-communicable diseases, which is one of the reasons as to why we are here today, cancer being one of the most non-communicable diseases around. So secondly, another thing that we run is the Social Innovation Hub, whereby we seek to incubate ideas that are brought about by young, innovative individuals. So right now we are in the process of looking how we can incubate these ideas and bring them out to the market to offer health solutions. So the third thing that we also focus on is our community empowerment program, which focuses on community engagement and collaborations in solving societal problems. So our focus is providing structures for communities to be able to lead healthy and productive lives. We know that we do not operate in vacuums, we live in a community, and especially as young healthcare professionals, some of our community members look up to us to be able to provide advice, or so we need to provide sound advice to them. So one of the things that we lead are community empowerment programs within Reculture. So our organizational structure, no need to see that is fine. Our partners and affiliates also, as you can see there, we work with Kenya Healthcare Student Summit, KEFSA, Respect, and Philips Pharmaceuticals. Our core values are humanity, integrity, professionalism, client value creation, and teamwork. So I think that gives us a brief about Reculture, and also something that maybe I should mention, we have the Youth Voices Network, which also seeks to create a community of young healthcare professionals, especially in the pharmaceutical industry and also in any other health sector, nursing or medicine, so that we can be able to offer training, internships, and mentorship in order to nurture healthcare professionals to become future leaders in the sector. So I'll be sending the Youth Voices network link in order for you to register in case you'd be willing to join. So that's it about Reculture, Health, and Social Innovation. In case you have any questions, you can reach out to us via info.reculture@gmail.com, or also follow us on our socials. We are on LinkedIn, Instagram, Twitter, and Facebook. Thank you. So just to start us off, I'll introduce one of our speakers for the day. That is Dr. Karen Muthembwa, who will also be joined by her colleague, Dr. Kohe Alexander. She'll be talking about cervical cancer, the risk factors, preventative measures, and she'll also be demystifying some of the myths that are propagated around the HPV vaccine. Karibu sana, Dr. Karen.
Hi, everyone. Can you hear me? Hi, Marion. Nice to meet you.
Yeah.
You can all hear me?
Yes.
Awesome. So I think I will start with a short introduction and then check whether my colleague is also in so that he can also introduce himself. But I thank you for this opportunity. It's a very amazing and very important and timely discussion that we needed to have for a long time. And this involves everybody, not just only one type of human beings, that's the women, but also involves the men, because HPV, cervical cancer, and other types of cancers that affect men too actually need to hear this information. So I'll introduce myself. My name is Dr. Karen Muthembwa. I'm a resident in obstetrics and gynecology. I work a lot with everything to do with women, particularly their reproductive health, but things that affect women also affect men. So it's important for, if there's any man here, they know that they're still very welcome to this discussion. I'm also very passionate about the youth, and I'm glad that we are doing the same things, making sure that we can pass our awareness to other people, and especially the young people, and get to improve our reproductive health in our society and in our community. I'm also the founder of Dr. K Foundation, which is a very new foundation where we deal with young girls. We started as Dr. K Under 21. That is a smaller group that had only youth. Any girl who was below under 21 years of age joined our WhatsApp group in 2020, and we started having discussions around reproductive health choices and the things that they do as young girls. And of course, it involves their personal issues like menstruation and those things that we could sort out at a WhatsApp level. So that grew up, and this year we started the foundation. So we've involved the Dr. K Under 21 group. And also as they grow up, because now the youngest is around 18 years old, the ones who've passed 21 years are now moving into another group called the Big Sister You Never Heard, where they will be taking care of the under 21s, because they've had these teachings for the last 2 years with great successes. And of course, we also have another arm where we deal with everybody now, including men and women of diverse ages above 21 years, where we discuss things to do with life. It's called School of Life. Understanding how to communicate better, making right financial decisions, and improving themselves whilst understanding their reproductive health. We understand that everybody who grows above 21 years, they'll be dealing with slightly different things from the ones who will be under 21. So I'm glad to be here. I will be having a discussion on cervical cancer. We call it CA cervix in the medical community. I would want to find out whether Dr. Kohe Alexander is here. Maybe he can introduce himself. Dr. Kohe? Marion, are you able to tell whether he's in or not yet? We can be able
He's in.
Okay, I'm sure you can be able to hear us. Dr. Kohe?
Oh, thank you very much. I hope I'm audible.
Yes, we can hear you.
Yes. Good afternoon. Thank you for having me here. Literally, it's my honor to be here. My name is, let me say it again, is Dr. Kohe. I'm a consultant obstetrician gynecologist with interest in literally educating, especially the young people, in anything in matters reproductive health. So I'm really honored that I actually approached Dr. K and I told her I'd be interested, and she gladly accepted to have me here. And I don't take it for granted. So I will support in whatever way and in whichever way she needs me to do so. Thank you so much.
Thank you so much, Dr. Kohe. That's Dr. Kohe. He's a consultant obstetrician gynecologist. We thought it was important to also bring the male perspective in our discussion because it's not only affecting women, but it's affecting everyone as a whole. I also, if you allow me, Marion, I just want to allow Knight. Knight is the one who coordinates the foundation to just say something small, 1 minute, only 1 minute, and I will continue.
Thank you, Dr. Hi, all. I hope you're all doing good. I won't switch on my camera for now, but good to see you all, and I'm looking forward to learning. And welcome to Dr. K Foundation. Thank you.
Thank you so much, Knight. That's Knight. She's coordinates the Dr. K Foundation with me, and we are all here together. So I think maybe I can start the introduction to what cervical cancer is. Please forgive me. I had a short time to prepare any presentation, but the one I have will be very complicated for most of you to understand. So I will just give you a very simplified version without a presentation, and then we can answer all your questions as we continue. I hope that's okay with you. Okay.
Yeah, that's fine.
Okay, thank you very much. So thank you so much. I will start with what is cervical cancer. And this is very important for everyone to understand because the cervical cancer is one of the causes of death in cancer-caused death in Kenya. And of course, very closely followed by breast cancer still leads, but we still have cervical cancer coming up very, very fast in our community. Whilst in other places in Europe and everywhere else other than Africa, there is no, cervical cancer is a little lower in terms of incidence as compared to being in sub-Saharan Africa. So that is why we need to discuss this cervical cancer, because it causes death, it causes very, very severe morbidity, whereby you cannot be able to do so many things as a woman. Your fertility is affected, your sexual life is affected, you're not able to, you get other complications with this cervix, which we'll discuss a bit later, that really are devastating, while we can be able to prevent this condition. So cancer, for example, let me start with cancer. Cancer is the abnormal growth of cells in an area of your body. For example, if you get breast cancer, not you guys, anybody who gets breast cancer, it's abnormal cells in that breast that become so many, but they're abnormal. And unfortunately with this is that they overgrow the normal cells and tissues and then take over the functioning of that organ. So the organ does not work very well. So that's what happens with the cervix. The cervix is part of the uterus, the part that opens up when you're giving birth. That part is now called the cervix. It's the one that you hear 2 centimeters open, 3 centimeters open. So that small part changes. It starts to have abnormal cells, and those abnormal cells start to become many and then to take over the functioning of that cervix. So what really causes this abnormal growth, you might ask me? So for cervical cancer, most of the people who get cervical cancer, it will be because of a virus called human papilloma virus. This virus exists as long as you have intercourse, as long as you've had sex, that you have a risk of getting this HPV. We mention it as one of the sexually transmitted infection, particularly when it comes to the cervix. If you've never had intercourse, you're less likely to have a HPV infection. You're also less likely to get cervical cancer. Then you'll ask me, then who is more at risk of getting this cervical cancer? Am I at risk? Is somebody I know at risk? Being a woman, is it at risk? Those are very, very important questions, because we ask then how many people, when they get HPV virus, who will get it? Because many people get it, but not everybody develops the cervical cancer. So there are different types of this HPV, and the most common that cause cervical cancer are type 16 and 18. And these two types are very, very strongly associated with getting cervical cancer. There are other types, of course, which are for those ones who have learned more about obstetrics and gynecology, but type 16 and 18 are the most important. We do have other types of HPVs that do not cause cancer, but they cause things like cervical warts, they cause vaginal growths that can happen in you, but those ones can, well, once they are treated, they go away. Okay, so there are people who, when they have this HPV 16 and 18, they develop the cervical cancer. And now these are the risk factors I will give you now. Someone who has had sex, who started sex very early in their lives. For example, those ones who started maybe at 16, 18, they tend to develop this cervical cancer because of the exposure to this type 16 and 18 very early on in life. It takes a long time before the cancer develops. And that's why we really talk about this cervical cancer, because we're able to catch it. If we're able to catch it at the right time, then we can be able to stop it and treat it early enough. So that's why we talk about, if you know you started having intercourse when you're very young, then you're at risk of getting cervical cancer. Then it will be important for you to know that you need to have regular screening as much as possible. Who else is at risk? Anybody who has multiple sexual partners. The more sexual partners you have, then the chances of acquiring type 16 and 18 anywhere along that path. So it's important for you to know that if you have multiple sexual partners, or you've ever had multiple sexual partners, then you're at risk, and therefore you need to have more a follow-up or investigations that can be done on you to catch it early on in life. We've also seen that people who are immunocompromised, if you have HIV, that HIV reduces your immunity, and therefore that HPV 16 and 18, your body does not fight it, or does, the changes that are happening because of that 16 and 18, the body is not able to fight because the immunity is not as good. So you tend to have a more risk of getting cervical cancer. And what we see here in Kenyatta National Hospital, sorry, I forgot to mention that I'm a resident in University of Nairobi, but I work in Kenyatta National Hospital. Most of our patients who have cervical cancer, when we screen for HIV, most of them will have HIV. So it's important, not everybody has cervical cancer because of HIV, but HIV increases the speed of how that cancer absorbs, or stays around the cervix, and you get the infection. So these are the main people who may, or who might develop this cervical cancer because of HPV. We also have, if you use a medication that reduces your immunity, that can also cause that. It's important to also note that condom might not provide enough protection from getting HPV infection, which means you can get cervical cancer even if you are using condom. You ask me why, and it's because the HPV is usually skin-to-skin contact infection. So if you have a condom and you protected yourself from discharge and all, but the rubbing of skin to skin can still pass that HPV from one person to the next person. So HPV is not fully protected if you use a condom. So that's why we do screening. So there are many other risk factors for this HPV, including smoking, obesity. So if you smoke, you're more likely to develop, sorry about the noise in the background, you're likely to develop this cervical cancer if you're a smoker, if you're obese, so those kind of things can also develop in you if you're not doing good follow-up. So I think also we wanted to find out how do I then prevent myself from getting HPV infection and therefore the cancer. It's important to note that sometimes you might not be able to tell who you are with, or maybe whoever you're with, because now it's sexually transmitted. Your partner might have had other people before you. Let's say this is your first time, you don't know, you might not know. The best thing would be get screened for the HPV DNA. Why? Because you might not feel anything, you will not see anything, there are no symptoms until when the cervical cancer has developed, and that is really late in in the progression of the cervical cancer. So if you have a partner, you just started, it's good to do screening. That's one of the ways you can be. Screening is not only to find a problem, but also to prevent infection. So if you're able to both do a HPV DNA, get checked for other STIs, then you're okay. Then you can also say, fine, we are good, we are safe. We can even do the vaccine. So that the other thing that you can do to prevent, of course, is reduce the number of sexual partners that you have, reduce smoking, reduce alcohol use, exercise, keep your body healthy, have the best diet. That also helps to improve your immunity. If someone is HIV positive, if they're able to use their medication as consistently as possible, then that will protect them from getting the adverse effects of the HPV and especially cervical cancer. What about the symptoms of cervical cancer? So I said at the beginning, the cervical cancer symptoms are not, you will not know. You will not know. Even doctors don't know. Nobody knows. Okay, that's why we say we can be able, when you're okay, that's when we do testing. Don't wait until you're not okay to be able to do testing. So just do now when you're okay, because most likely we'll find that the test is okay. If we find the test has a problem, at least it's not in the last stages of cervical cancer. And that's why we say, okay, fine. If there are no symptoms, then what are the signs of it is well established, maybe it's a visible lesion, something growing in the cervix. Those symptoms are usually bleeding. Anytime between your period, it can happen. It's called intermenstrual bleeding. So if you have intercourse and then you have bleeding after intercourse, then the chances are there's something wrong with the cervix, because when you hit inside there where there's something growing, it starts to bleed. If you're now having very, very bad discharge that's not being treated with medication, it's not getting better with antibiotics, then it would be good to get checked. Okay, so these are the minor symptoms that you can get, but major ones that you can get are now, if you have a growth inside the vagina, you can even see the growth, you can feel it. Sometimes it produces the cells or the tissues that can actually come out on their own. You're having very, very bad discharge, it's smelling very, very bad. And then you also have bleeding, even when you don't touch, it's bleeding. And now it's painful. When it's painful, this means it's probably gone further. When it's not painful, it's probably earlier. Okay, but pain is not a very good measure of whether it's early disease or late disease. Other things you can get is kidney failure, because this mass, as it's growing in the cervix inside, it is expanding outwards. It is now compressing on the tubes that take your urine inside the bladder. So what happens? It blocks those tubes, and then it has a backlog. The kidneys are producing urine, but the urine cannot pass. So you have something called hydronephrosis, which is your tubes now start to fill up with the urine, and there's nowhere for it to come out. So the kidneys fail because now they're overworking. So that's one of the advanced signs of having cervical cancer. Other things like of constipation, something growing in the stomach, it's now big, it's painful. You're having issues with breathing because now it has gone to the lungs, or maybe you have a back pain that's just not going away. Eventually, you have problems walking because it's compressing on the nerves. It can also go to the brain, it can go to the liver, So this is now signs of advanced disease. Usually most people show up when the kidneys are failing, and that is usually stage 3B. There's early disease and late disease. So anything from stage 2A and above, we consider it as advanced disease, but there are medications and things that we can be able to do. So I wanted to ask Dr. Alexander whether he can hear me. Can you hear me? I'd like to invite him so that he can give you just a little bit and an overview of how we manage this cervical cancer in most of the patients, and especially when it's early disease and late disease, and talk about a bit of the vaccination. Hello? You want to be unmute, okay? Marion, please check whether you can unmute Dr. Kohe.
Yeah, he's unmuted.
Okay. In the meantime,
Yeah.
yes, okay.
Thank you so much. So you had wanted me to just mention a little bit, an overview on the management of cancer of the cervix, and also talking a little bit about the vaccination. So again, as you put it very correctly, remember this is a disease that can get you at various stages. You can get it from what we call the pre-invasive part, and pre-invasive just basically means that you have started forming the cancer, but it has not yet spread, as Dr. alluded, to other parts of not become like a fully functional tumor and has not spread into other parts of the body. So now when we look at treatment basically is dependent on what we call the stage and where we get it from. So if it's in pre-invasive, meaning that it has not yet developed, this is when we can do quite a few options. Most people prefer surgeries, but if, for example, now I'm just thinking someone who's young, you've not had your children, and you're being told, okay, you have cervical cancer. Don't worry, there are options that can be done. So which range from one, like the cryotherapy. This means where we come and we actually can freeze the cervix, and by freezing the cervix, we destroy the cells which have. It's actually a process of freezing and like that multiple times. And by doing this, you are able to destroy infected cells where the virus is, or which have shown that they are a bit abnormal. The second thing is we can also use it. We can do something called LEAP. LEAP is where you actually are able, through an instrument we call the colposcope, you're able to identify areas which are abnormal or look like they are cancerous, and you're able to remove them with a hot ring. So it's like a heated ring where you're able to, the patient is first of all anesthetized or given anesthesia, then you're able to remove that part of the cell. Another thing you can use nowadays is something called thermoablation, which is just the same thing where you just burn the affected part of the cell off. The surgical options, there's also part of it where you want to only remove the affected part of the cell. There's something called a cone biopsy, where you literally just take a bit of like a cone shape, you cut that part out, but you leave the rest of the normal functional cervix in. So these are for women who desire to childbirth and desire to have children, and I give them that option. But for women who, for example, you've finished having your babies and you feel like, okay, I'm done, we can actually just do a procedure called a hysterectomy to remove the uterus. Now, again, the management, as I told you before, alluded before, depends on the stage that you get this disease at. If we pick it up now at a more advanced stage, we may have to do now even more surgery, because remember, these cells can spread into the various blood vessels. They can spread into what we call the lymphatic system, and the lymphatic system is where now your immune cells rest. So once it goes that direction, remember, it's going literally everywhere. So need to be more aggressive. So you may need to remove the whole cervix, the whole uterus. And then for some even advanced cases, part of the organs that it's infected. So if it's spread to, so for example, if it's the bladder, the rectum, and etc. Again, if for patients who the spread is too much, and we look at it and they may not be able to handle surgery very well, we may have to do now opt for things other than surgery. So in this case, we have two options, which is chemotherapy and radiotherapy. But nowadays we do a combination of both, because it's been shown to potentiate each other. So some of these patients may have to undergo what we call chemoradio, which is just combination of chemotherapy and radiotherapy. And so, as Dr. had put before, the earlier you get it, the earlier you can, the better prognosis, meaning that you can recover fully and you can have get the cancer out, as compared to if it's very late stage. Dr. had also wanted me to talk about the vaccines. So currently in the market, we have two vaccines, and these vaccines, remember, these vaccinations are not curative, but it's to prevent. So remember, there are four aspects of prevention. The first aspect is primary prevention. And what does primary prevention mean? Prevent yourself from getting HPV. And how do you prevent yourself from getting HPV? The best thing, which is not always practical, but is abstinence. So abstain as long as possible. The second level of primary prevention is now you have been exposed to the HPV virus. How do you prevent it from getting? How do you prevent or minimize the chances of it infecting the cervix? So that's where, as we said, using protection, ensuring that when you have STIs, you're treated for those STIs, preventing yourself from getting HIV, ensuring that you are reducing the number of multiple partners. If you smoke, don't smoke. And yeah, and if you're using oral contraceptive pills, possibly, or if you're at risk, possibly, have an alternative mode of family planning. The third level of prevention is that now you have now the infection and there's a bit of an abnormality. What do? We screen. So emphasis on the screening. So screening now is when you can do some things like I'm sure all you guys have heard about a pap smear. There's also something we call HPV DNA, where we're able to actually look at the DNA of that virus and detect whether the cancer-causing viruses are present in the cervix. And then also we can do now in facilities where in rural areas, we can do something called viability. That basically means that when you look at the cervix, you take some vinegar, literally, and you paint the cervix with some vinegar. So you try to see if there are some abnormal changes on the cervix, and then if you proceed to paint it with some iodine as well, and you confirm the first test. Yeah, so that is that. And then the third one is now, how do you prevent now, once you've gotten, let's say that there's an abnormality, how do we prevent it from becoming full-blown CA cervix? So now those are the treatment modalities that I had mentioned about right now. So when it comes to the vaccination falls in the primary prevention as well. So abstinence and primary. So what you're doing is basically let me give a small introduction of how vaccines work. Remember, a vaccine is just a foreign body that you're giving a human body so that the human being, so that they can induce an immune reaction. So in this case, you're giving a bit of that virus so that your immune cells can recognize it and they can produce cells to target it, so that if you get infected or subsequently it comes into your contact with your body is very quick in launching an immune attack. So that's what it does. There are two vaccines currently in the market. There's one called Cervarix, there's one called Gardasil. So Cervarix it protects against two cancer-causing types of HPV, that is 16 and 18. Now, Gardasil is the one which protects against 4 types. So in addition to that, remember, Doc may have said, I don't know that she had said, but HPV can also cause other forms of cancer, not necessarily just cervical, but it can cause oral cancer, it can cause penile cancers in the males, it can also cause genital warts. And this means that you just have a concentrated amount of HPV hanging around in your skin. Yeah. So these ones also protect against now the Gardasil protects against the 2 cancer-causing one and the 2 that cause those genital warts and other cancers. Yeah. So currently the 2, like the Cervarix, is only given to girls. So you take it if you're injected today, you get a second dose after 6 months, and the target age as per the government is 9 to 14 years. Whereas the Gardasil is given at 0, 6, and 12 months. So, or rather, you give it 0 within a month, and then after 6 to 12 months. So you get 3 doses. So as in terms of cost, most people are leaning to show that Gardasil may be a bit more effective, but again, it depends on the cost, because most of the one that's being offered currently is Gardasil. But there was a time when it was only Cervarix that was being offered. Then again, like any side effects, remember, side effects of vaccination, you can just range from no effects to actually a few getting very life-threatening effects. But again, that depends also on what you're allergic to, because some of these vaccines could be made with some substances like egg yolk and things, and some people who are allergic to egg may have a allergic reaction. So in summary, what we're saying, please note that there are 4 levels of prevention. Vaccines fall there. Treatment is available, but please, as much as possible, get screened. Ensure when you see your doctor, let them do a full exam, head to toe, examine your breasts, examine your abdomen and look at your cervix, ensure they look at your cervix, and also they may have to also, in unique cases, examine your rectum as well. Then let them assess your risk profile and see whether you need to proceed to having one of those screening methods done. Then after that, they will guide appropriately according to the result that comes. Thank you so much, Dr. K.
Thank you so much, Doc. We really appreciate, because this is very important information about how to what to expect, especially when you're diagnosed with cervical cancer. Remember, it's not a death sentence. The earlier we get it, the better, and the things that we can be able to do, and especially if you intend to maintain your fertility. So, for example, you mentioned about the cone biopsy. When it's very, very microscopic, it's, when it has just been recognized, even by, by simple tests, we are able to remove that cervix, and still be able to retain the uterus. Remember, if it is in stage 1, stage 2, very, very early, we can be able to also remove the whole system and be able to eliminate the cancer fully. So don't be afraid to do these tests. And talking about tests, I wanted to talk about a few tests that we do that are important for you to know that exist in our market. Not really market, in our hospitals. Let me remove that word completely, but in our hospitals, and that is the pap smear. That is the one that is almost everywhere. The pap smear is one very important test that is able to pick up changes in your cervix, and most of the time it will pick up when they are not yet cancerous, but those changes can lead to cancer. So we're able to treat them as early as possible. There's another one which is called the HPV DNA test, which can be done concurrently with the pap smear. The HPV DNA test is to pick out that HPV, those 16 and 18 we were talking about, and there are many others. They take the most common, the ones that cause the most cancers, cervical cancers in our setup. So we are able to do that. And if we are able to find that you're negative, then we say, good, you're negative. Now take care of yourself, prevent this, do this. You can be able to now work around that. If it is positive, then there are other things that we do to either manage the fact that you're at more risk, probably like because you have immunosuppression, meaning that your immunity is low. We are able to do things to prevent the quick progression of that cervical cancer. It's also important to note that if you're coming from a very rural area, they might not have pap smear or have the HPV DNA. So they will do something called a via villi, which Dr. Kohe has talked about, where we put some acetic acid, which is like vinegar, and then we look at the cervix. If there's an abnormal cells, there's a way it shows us that this area here needs to be investigated further. So it don't say that via villi is not important. It's still very important because we use it even during our treatment. So I think those are the basic things that everybody needs to know about cervical cancer. Just remember that you can prevent cervical cancer, yes. Best prevention would be to abstain, but since we want to reproduce, we want to still have sexual intercourse, then have that test first with your partner before you can be able to go ahead and have intercourse. The other thing is, it's important to still screen. It's part of prevention, not just to diagnose you, but to be able to prevent know whether we need to do something about where you are at this stage. And in case we find a cervical cancer and it's in early stages, then that's better news than if it was at the end. And that is the message we want to give you. And we talked about prevention being vaccines. Vaccines are very, they are available in Kenya, and we should count ourselves blessed because other countries don't have free vaccination for young girls. And this country, at least our Ministry of Health, has been able to roll out, it was actually 3 years ago. Unfortunately, the vaccines are getting expired in our setup. So please make sure you use that opportunity to get the vaccine. Yes, it's possible to get the vaccine at that age for a girl for free. we are also giving an opportunity for those people who also want to get vaccination. For a young girl, they probably get 2 doses. For when they're grown up, you know, if it's between, you're around 15 to 21 years, you can also get the vaccine. It doesn't stop you. Actually, you can get even up to 45 years. After 45 years, you cannot get the vaccine. No, you can, but it's not beneficial, because already if you were to develop cancer, you would have developed by the age of 45. So it's good to note that it's not all lost, that you cannot not get, it's still possible. And not to forget our boys, because our boys, when they grow up, when you have the adult men, they are also playing a part in cervical cancer. And that's why we involve the men, because if you're having intercourse, then you're likely to infect another person with HPV. If you had a partner who died of cervical cancer, you're at high risk of infecting the next person with the HPV DNA that's still caused, not because it's your fault, you just didn't know. Nobody knows. So we are not blaming anyone, but it's good to note that someone can be more at risk to even cause it. And it's not just women, but men play a part in cervical cancer. So we need to remember about the gender factor, which plays a role in the high levels of cervical cancer in Kenya. I'll take you back to Marion. I don't know whether there were any questions that needed to be answered or myths.
Thank you so much, Dr. Karen and Dr. Kohe, for that informative information. So I'd like to request our participant or type them in the chat box. So even as we wait for participants to give questions, maybe I'd like to ask a question. In case you've previously had sexual intercourse and you're above the age of 9 to 15 years, can you still get the vaccine?
Well, for the vaccine, it's preferable that it's given to those young girls before sexual debut, but it does not stop you from still getting the vaccine. It may be, we are still doing studies on how beneficial it is to an older a lady or older girl, considering that they've already been exposed, probably exposed to the HPV secondary to having sexual intercourse. It would also be important to still have the HPV DNA test. It's still possible to do that, so that at least you know that you don't have it and you started with the vaccine when you don't have the HPV DNA test, DNA positive test. So it doesn't stop you, but it's preferable that you had not had intercourse. Maybe Dr. Kohe can add on to that.
Yeah, thank you so much, Doc. As you said correctly, the best time would have been to give it when before debut of sexual intercourse. But it does not mean that now that you've had intercourse, that it limits you. The thing is that it will just reduce the effectivity as compared to someone who has not had. But you can still go ahead, and the younger it is, the better. Because what even research has shown is that most girls between 20 who are sexually active, if they have their sexual debut between around 18 to actually 26, 27, their immune system is able to clear the human papilloma virus that is there. The issue is that after that age group, you find the immune system becomes a bit lax. So it's not able to be as, the surveillance is not so good. So you see, once you are backing it up with the vaccine, you're able to stimulate the immune system to produce antibodies, so that, to produce cells that are able to detect and also eliminate the virus, the HPV virus, or when they come into contact with it.
Okay, thank you. I see we have one question in the chat box from Dennis. He says, what is the procedure when...
Okay. I don't know whether it's me, but the sound has gone. But yes, I think Dennis is asking, good afternoon, what is the procedure when using acetic acid for testing of cervical cancer? It's called VIA villi. VIA means visual inspection with acetic acid, VIA. Then villi is visual inspection with Lugol's iodine. So we do those two. So first we do the acetic acid. So obviously you can't do this at home to test yourself. It can only be done in a setup where there's a health professional who is able to put something called a speculum inside, and then we are able to visualize the cervix. Once we visualize the cervix, we put the acetic acid. The acetic acid will tell us that this area, because it's going to turn white, the cervix is pink, but that area with a problem, which we are not sure what it is, so it's not a confirmation of cancer or anything. It just tells us these cells here are abnormal. Then after that, we put now Lugol's iodine. It looks like something called, it's brown liquid. We used to clean, something like that, brown liquid, which we use. It's called iodine, where you put around the cervix, and then it enhances the area that has a problem. So it's called VIA villi. So if you're in the peripherals or periphery areas, you can ask to have a VIA villi if they don't have a pap smear. At least it's good for screening. I think I can also add something about pap smear. It's good to note that anyone who's above 21 years of age is encouraged to start having their first pap smear. Usually the second, you should do it regularly at around 2 to 3 years. And if you have an immunocompromised disease or you're using medication that is reducing your immunity, you need to have it yearly. HPV DNA can be done once. If you do it before 35 years of age, if you have any HPV DNA test, which you can actually consider to do it at home, there's a self-test kit that can be bought in any pharmacy or particular laboratories in Kenya, where you get the self-testing kit. It has very clear instructions, and if you want to know one of them, you can check my Instagram account where I've described how to use one of those tests. I think it's one of the posts I've put today to see how it's used. It's very easy. And then once you're able to do that, you send it to the lab, you get the results yourself. And sometimes they're able to help you with that. The information they give you, they tell you, you need to go back to the hospital or this is okay. So don't be afraid to do these tests. They exist and you can do them at home, just like the HIV test that you can do at home alone.
Okay. We have a comment from Jacqueline. Hello, I think Gardasil 9 should be used as HPV vaccine because it's effective for all. Okay. Also, we were looking to demystify some of the myths, Dr. Karen. So one of the myths that we hear is that HPV causes infertility. So maybe if you could address that.
Well, sometimes we the medical fraternity look at some of the comments, and we take it very seriously because the information that goes out is very, very important. And there's always broken telephone as well. When one gives information about something, for example, if you're talking about how to do a bilateral tubal ligation, they'd say if you funga the tubes, then people will have no interest in having sex. But we ask, where did that come from? Okay, so that's just one example. So when you look at the vaccines, and they've been studied over the years, there's no clinical evidence that shows that this vaccine is going to cause that will stop you from having pregnancy. In fact, the people who've had the vaccine, you see, it protects you from death. You're able to conceive. So if you die earlier, then you don't get fertility, So if you look at also the contents, it's important to still do your own research. Don't listen to other people, do your own research. Look at the studies that have been done, because we do studies every single day. There's no clinical significance of any form of infertility that has been noted with this vaccine. And definitely usually we don't release vaccines unless they have been in the process of testing, and there's levels of testing of what this vaccine is capable to do in the body. Yeah, so I'd rule out the fertility part, because we've had people who've still conceived after getting the vaccine, and then of course whether it's safe or not, it is safe.
Okay, thank you.
I would like to add one thing about,
Yes.
as I said, there was some, could you please repeat the first part of the statement, because there was something I didn't hear so well, then I'll join it with my comment.
Marion, I think it's the statement you made. The
statement about what, Dr. Kohe?
No, I just wanted the first part of the question that you read. I've forgotten what I was going to say. Then I'll add it to the second part. The question you've just read right now.
Oh, it was about the misconception that the HPV vaccine causes infertility.
Yes. So basically, I was just trying to say that there have been a lot of myths that have been going out, and maybe because I think also one of the reasons is we have not been able to explain, and we have not also done a good job in sensitizing about the importance of why the vaccine must be given. The vaccine is very harmless. Okay, let me say not say very harmless, but its safety profile is good. So it's shown that they have minimal side effects, as I told you, unless maybe someone is allergic to the ingredients or the components of the vaccine. So someone should not peddle those rumors. Number two, I don't think anything would be causing infertility. For it to be causing infertility, it would have to block the tubes. It would have to reduce your hormones produced in your brain. It would have to affect the hormones also produced in your ovaries or in your testes. So I think that's a lot of, we want to push a lot of those myths. And a lot of these people who are spreading that have some sort of agenda, which we do not understand. But we're here to tell you that that it has been proved that it's actually safe, and therefore the CDC and WHO to endorse it means that it's undergone various levels of clinical testing and rigorous testing as well.
Thank you, Dr. Kohe. One last thing for me would be another misconception that giving the HPV vaccine to young girls is tantamount to encouraging them to have sex early. And also you have noted, Dr. K, that the response rate or the uptake rate is quite low, and unfortunately vaccines are expiring. So how can we encourage uptake amongst young girls and even mothers who are the gatekeepers to this?
Can I please answer this first?
Yes,
I think I'm very passionate about this answer. Number one,
yes, please.
I find it very disgusting, to say the least, when people are trying to appreciate that, because we have a lot of, a lot of patients who are actually being diagnosed with cervical cancer. And if only this information had been disseminated earlier, maybe it would have been in a different stage. This program, actually started around 2019, 2020, where they were trying to vaccinate the young girls between 19 to 14. But of course, some religious groups and some people with vested interest came out and said, no, it's like tantamount to promoting sex. But what someone was telling them is that, one, what you don't know is most likely your children are indeed having sex. And if they are, well, how do you protect them? You need to ensure that you have given them and armed them with knowledge, and also they know the consequences about their actions, so that if they decide to engage, they know, if I'm doing it, at least I am protected against A, B, C, D, E, or potentially I can get E, F, G, H, I. Another thing is that when you look at, as I think another point which has been raised, which I forgot to talk about, is that the Gardasil 9 is the best. In an ideal setup, it would have been the best, but because of the costs, currently right now, I think one shot is about 55,000 shillings. That is out of the reach of so many Kenyans. So hopefully with a lot of lobbying and possibly a lot of fund, the government can try to engage the stakeholders and partners to ensure that this cost is actually minimized and it's affordable to the common mwananchi. But in terms of promoting sexual promiscuity, I think at the end of the day, that it has nothing to do with that. Studies have actually been shown that according to, for patients who are given the vaccine, it didn't really change much the debut of sexual intercourse, or the number of sexual partners did not go up. Thank you.
Right. I think Dr. Kohe has said it as it is, and just to reiterate, because it's very important for us to note, as you know, now we are informed about this. What are we doing about our information? And especially those ones who are listening right now, what happens at home? Do you pass this message to the rest of, you know, it's up to us, because we are having this meeting for a reason, not just for ourselves, but also for the people around us. It's important for us to know that because you've added something does not mean that another thing is being encouraged. These children are very young. They don't understand even what, you know, we don't know. Some of them might be, but they don't, you know, before we start thinking that because we're giving them condoms, they're going to have sex. Probably they just know, but they'll be more careful. We haven't thought about that other side of knowledge, which is also a possibility. So we cannot say that we will not give them a vaccine, because they will have intercourse whether we like it or not. And now the sexual debut is younger than 18. Now it is down to even 13. And this is things that we're actually seeing and delivering. My youngest patient I've delivered because she was pregnant was an 11-year-old. So tell me, are we really doing enough to help our younger children? So that's why some of us, you know, why we do what we do is because it's information that's power. Information about the vaccine. What you do right now matters. How you protect your mother at home who does not know anything about cervical cancer. At least you'll say, today we had a discussion with this doctor and this doctor, and they said that we need to have pap smears done on this when you're above this age. You know, by the time you're above this age, then you're most likely not going to develop it, but does not mean you cannot still see a gynecologist and let them advise you what tests you should do. Don't be afraid. You know, so this is the information we need to do. I suggest that we get together. I think that is the recommendation I would give. We get together as a community. We have the same goal, the same things we're doing right now. Our webinar is good, but is it enough? Are we getting down to the grassroots? Are we going to Mama Mboga, who's selling boga right now and not listening to this, you know? Sorry about that. Are we getting to that young girl in primary school and letting them know that they have the power to be able to decide things on their own and to say no to wrong things at their age? You know, the information that sex is good, but at the right time. And these are the things now I do discuss with the young ones. And I know a lot of challenges, you know, the under 21 group, they have a lot of challenges, not just decision making, because decision making is what makes that decision. Say, okay, fine, let me have sex today, it's gonna be okay tomorrow. And you forgot that there's a vaccine, you forgot that there's condoms, you forgot, you know, when you can be able to negotiate with your same gender at the same age. These are the things we need to empower these girls to do, these young boys to do. As much as we're teaching them to negotiate, they're also learning that as much as I want to do this with this girl, or this girl wants to do this to me, then I need to know how to negotiate my way. And if I do really love her, I need to protect her. And that's the truth. If you really care about somebody, you want to protect them from these problems. And of course, intercourse, apart from infection and cancers and all this coming in, there's a lot of emotional changes, emotional involvement when it comes to things to do with intercourse and what you decide to do. That changes a lot of things, and even economical changes. So these are the things we need to do. If we can come together and spread the news, it's good news. If you test and you test it early enough, there's something we can do. Don't be afraid. We are here to help you.
Thank you. Another question from the chat is, a 3-year-old, the villi sounds positive and the pap smear also suggests cancer. What will be the next step? Dr. Kohe?
Okay, maybe there's an issue with the unmuting.
Okay.
Yes. So if you're 22 years and you turned positive for the PAPS, for the via villi, the via villi is not specific. It doesn't say that you have cancer or not. It's very rare to get cancer at 21. Very, very rare, very rare. Why? Because it takes time before the cancer develops, okay? So it's probably that she got some changes because of an infection in the cervix, which can be seen on the via villi and can sense that there's a problem with the cells, but they are not cancer. You cannot confirm that they are not cancerous. They can only say there's a problem with the cells. After she did the pap smear, it was suggestive for maybe changes. I don't think it was cancer. It's very rare to get a 21-year-old with a cancer. As I say, it's very rare. So if they got a change on the pap smear, the pap smear also picks up non-cancerous things, and those non-cancerous things are the ones that can lead to cancer but can be managed. Okay, so different diagnoses you get with pap smear. The details as to the details, some of them, just get them on our socials. Get them on our socials, because I've talked about CIN, I've talked about low-grade squamous epithelial lesion. If you see something like that on your pap smear, L-seal, H-seal, CIN2, CIN3, those are just results, but they're not necessarily cancer, okay? But there's that one that is high grade and there's that one that is low grade. High grade, which means it's closer towards getting into cancer than the one that is low grade lesion. So it's important to know what exactly is written in that pap smear. If it's written something that's not normal, because we usually say normal epithelium, if it doesn't say that, then get to see a gynae, because each step has its own treatment. So I don't think the 22, 21-year-old has cancer. Let her get seen by a gynae, let her get the right information. Probably it's just a change that can lead to cancer, but not the cancer. If in case it is a cancer, then probably this thing started a long time ago. We don't know. And she has maybe things that are reducing the immunity, things like drugs, maybe like you're on medication for something else and it reduces your immunity and then you develop the cancer faster than the other, or you have HIV, you have things that will reduce your immunity, then that's the possible result that they can get. The alternative is maybe she's not 22. Maybe the age is wrongly put. So it's important to look at all those factors. Thank you for that question. It's a very good question.
Thank you, Dr. Karen, for answering that. I think if we do not have any more questions, we are joined by Sally Agallo. Oh, I can see a hand raised. You can go ahead, Knight.
Thank you, Marion. I have a question, and my question is, how is the pap smear done, and is it painful?
Let me answer that.
Right.
Now, the pap smear usually is done at your healthcare providers of either the hospital or the clinic, and it's usually an outpatient procedure. So basically, the most important thing is that your healthcare provider should explain to you what you're doing or what they plan to do, and they should also seek consent. And especially for us who are males, and we're male gynecologists in this field, we must always have a chaperone around. So when this happens, the doctor will proceed to ask you to undress and then cover yourself with a towel. And then after this, they'll either ask you to bend your legs, or assisted they'll help bend your legs, or there are some beds which actually have some straps which will allow you to have your legs bent. Then they insert an instrument. No, they first clean your I mean, not say the vagina, because the vagina is technically not the right term, but the outside, which we call the vulva. Then they insert the instrument called a speculum. Now, this speculum will allow us to do various things. We'll be able to we'll be able to visualize the walls of the vagina. We'll be able to visualize the cervix, see how it appears, is there any bleeding, etc. Then from there, once we see that, it's basically we take a brush, and this brush we insert it. Part of it, now the modified one, has a part where you insert into the cervix and a part which picks the cells outside, and you rotate the brush 5 times, and then you smear it on a glass slide and you fix it with a fixative agent so that the cells don't get destroyed. Then from there, we are able to then send it to the pathologist for reporting. And of course, you thank the patient, and then you tell the patient, usually in most settings, it takes about a week to 2 weeks for the result to come out. But of course, pain threshold among patients is different. There are some patients where they don't feel anything at all. For them, they say it's very minimal. And there are others where they'll tell you they were knocked down by a train. So as much as possible, you need to explain to them and ensure that they're comfortable throughout the procedure. Thank you.
Knight, I hope your question has been answered. So moving forward, we have a cervical cancer survivor, Sally Agola, who will be giving her testimonial, talking about her experience and her cervical cancer journey, just to bring us closer home and to help us understand why there is need for cervical cancer eradication. Sally, if you're in the meeting, please go ahead.
Thank you so much, Marion. I must say I'm privileged to have been given this opportunity, because it's many of us who would have shared their stories, but have been given this chance, so I am humbled. My name is Sally Agalo. I was first diagnosed with cervical cancer stage 2, and that was in the year 2007, when there were no interventions like there are now. And I'm really happy that there's a lot of change now. And before that, I had HIV. I'd lived with HIV since 1999. And as we've heard from the doctors, it is a big risk once you have HIV, because you have immunosuppression. So I thank God for the organization that I was working for, because they were really keen on the staff, and especially people like us who had HIV. And so we were screened every year. For that time, I think it was just pap smear. But for my case, when the screening was done again, the doctor said there were abnormal cells, and a further investigation revealed that I had cervical cancer, and then they did staging, and it showed that it was already in stage 2. What really shocked me is that we do not have history of cancer in my family, and I had lost 2 babies from HIV, because again, that time when I got HIV in the 90s, there was no prevention of mother-to-child intervention that we have now, and I'm so happy that women with HIV can now give birth, and their children are not getting HIV. So for my case, the risk was there, and so when the doctor said, there are so many tests that are done before even you get to start the treatment, and mine was urgent because of the exposure. So I had to sign a consent with my husband for total hysterectomy to be done. And I didn't take it lightly, because that meant that I was not going to have children anymore. But I said, okay, if it was going to save my life, then why not? And my husband really encouraged me that it is fine. I mean, we can easily adopt babies, because there are many others out there who have babies, but maybe they are just in homes. So that encouraged me. And of course, with the organization I was working for also really, really supported me. And we signed the consent with my husband. Unfortunately, it dawned on him after the surgery was done, like, oh, we can't get children. So he actually left me, and I suffered stigma so much, to an extent that I got depression, I attempted suicide, and it was just a hell of things. But anyway, to cut the long story short, I'm now a patient advocate. I have chosen to be vulnerable and share my story to people and tell them it is possible to survive a cancer diagnosis, whatever cancer. Mine was cervical. Although I got after the treatment, my treatment took about 3 years, because it was basically surgery. I could not go through chemo and radio because I had very low white blood cells. And so my treatment for cancer has just been surgery until 2010. Then, okay, I was told all the cells were cleared, but in 2010, as I continued going for the checkup, it was found that I got cancer again, now this time in the colon. which spread to the rectum, and now I have a condition called ostomy. But anyway, coming back to the HPV vaccine, I am an advocate for that as well. And I want to share my experience from the HIV world. I'm among the people who were involved in advocating for ARVs that they are working. And I must thank an organization called MSF Belgium. They actually employed me. I'm not a medic. Okay, I call myself now a QBE. I'm qualified by experience after working with them for 15 years. And that was a privilege also, because they trained me that as much as I'm sharing my story, I need also to have the facts about what is HIV, what does it do to the body, and what are the opportunistic infection and everything. And people like us were used to pass information about, and that cleared the myths, because if you're working for a medical organization, everybody will call you daktari. So you're wearing the white coat, the dust coat, and so everyone knows you are a daktari. So if you tell people mimi ni daktari na nakunywa dawa, then they say, hey, kama daktari amekunywa na anakaa vizuri hivi, then why not? So we were going to the field. That time I remember we were walking in Kibera, door to door, telling people that I have HIV, I am using this medication, and look at me now. So you can also survive. So I would like to say that I'm a Christian, so I'll quote the Bible. Hosea 4:6 says, my people perish for lack of information. So people are refusing to take this vaccine because they do not have information. And I excuse my husband, may his soul rest in peace. He left me, but he later on passed on. I realized that he ran away because he did not have information, and no one gave him that information. Maybe he could have stayed if he got that information. But I realized that a lot of people don't have the information, so it's just rumors, and then people buy the false information more than they could buy the right information. So if we go out there, and with especially people like us who have survived, okay, we are told in Kenya 9 women are dying every day from cervical cancer. How many have survived? I'm sure there are. I belong to many support groups of women who have survived cervical cancer. Okay, not many of them are willing to speak and go openly about their status, but they are there. So if that data can also be shared, then that can give people hope. And again, on the HPV vaccine, since we started giving it to our girls, there's so many women now whose girls have been vaccinated. Can we use them? Like in HIV, we have the community health volunteers who are going around telling people to go to the VCT, and those who have been tested to continue with their medication. If we can borrow that leaf from HIV world and say, people like Sally and many others who have survived can be trained on what the human papilloma virus is and the HPV vaccine. So then when we go out there, we are able to give the correct information and demystify the myths and misconceptions that is out there. And the women also whose children have been vaccinated can come out and say, my daughter was vaccinated in is it 2019? And she's gotten her second dose and she's here and she's fine. And those who have survived cervical cancer also to share. Something else I would like to say is that I did not have any symptom at all. It was just a routine checkup. And then they realized that I had abnormal cells, which turned into to be cancerous. So again, I would say the reason why maybe the women are dying, it's because the diagnosis is found very late. So if women can just go for the screening and not wait for the pain, like we have VCTs all over. If the same thing can happen for cervical cancer and for the HPV vaccine, I think we will conquer, because cervical cancer is a cancer that can be eliminated. And I am one of the people who say that I survived, and I know many other people who survived. So again, I would like to emphasize that let us use the people who have gone through the experience. It is just like Christianity. You are born again, so you share your testimony about Christ, and then someone else receives Christ. So let us use the people who have had the vaccine, people who have gone through cervical cancer. Cancer as pain that I wouldn't wish my worst enemy to go through, not even Al-Shabaab. It is pain. So let us not wait for that pain. Let us start early. I don't know how early we can go to this for the screening, but as soon as we can. We are told that now all the government facilities are available with this kind of information and the screening. So let's take that opportunity and let's do it. But again, something else, talking to women and encouraging them to go for the screening, I find that what scares people most is the cost of treatment. They say that what you don't know does not hurt you. So they say, nikienda kupimwa, then I get that I have cancer, then where will I get the thousands or millions of money to treat myself? So I'd rather just not even go. And I mean, I will stay until the day God calls me home. But I think that is not a very good idea. Let us take the opportunity of these facilities that are available, and let's do it. And once again, I must really, really appreciate for this opportunity, and I wish we could have so many other people on the call. My story is all over the media houses, and you can find me on Facebook as Sally Kwenda. And if you get any link of my story, please share it widely. That is the legacy I would love to leave when I go. Asanteni sana.
Thank you so much, Sally, for the work that you do to advocate towards cervical cancer screening. I think it speaks to the fact that prevention is better than cure. So we are also very privileged to live in an era where we have the vaccine. So let's take advantage of that. Let's help create awareness and encourage the uptake of vaccine and routine screening.
Marion, before
Yes.
you close, I think I want to just say something small about, I really appreciate Sally because we as, and personally, even Dr. Kohe will attest, is that sometimes we see very devastating things. We see, but they experience every single thing. So Sally, we really, really appreciate you because we such things we want to also give our patients. I wish we would have more of this so that we can also give the ones we already have hope that there's possibility of being able to manage cervical cancer and being able to, improve our, our living and our life. And it's important to note that it's not just, Sally has given a very important information about how men, and this is why men come into this, how men play a part in how we manage our women. You see, the cervical cancer did not bring itself. It's due to infection, and it's from one person to another. So it didn't bring itself. And I wish men would know that they still participate in developing, but at the same time, it can also affect them. They can get penile cancer, as Dr. Kohe had mentioned, they can get anal cancer. Very, very common, actually, and also esophageal. It goes even to the neck. So it's important to know that this HPV needs to be, found early enough. And it's not like if you get a diagnosis of cervical cancer, it means a death sentence. No, we're able to do everything in our power to help our patients. So I appreciate you, Sally. I'm really touched by the story, and I really understand where you're coming from. So keep up, don't stop, don't give up, just keep going. Thank you.
I'm humbled. Asante.
Thank you. I think she also mentioned some of the complications of the cervical cancer. I didn't go deeper into them, but so it's important to know so that you can go for screening, that some of the complications really affect us as women, and especially not just physically. Physically, it affects other parts of the body. You can lose the uterus, you can lose the part of the gut, it can still go to the backbone, it can go anywhere. Okay, so, and of course it even affects our emotional self, as she said very well, that it's not just physical, it affects us emotionally, mentally, and also our relationship with other people. So it's good to be very kind to people, especially when they're going through something. Just be present and be there you know, and then it's not the end of the road. People can still conceive in different ways. So even if someone does not have a uterus, and if you still have your ovaries, you can still get your eggs, and we can do something called IVF. So it's not still the end of the road. Yeah, that's for Sally as well. Thank you.
Thank you so much, Dr. K. We are coming to a close, so I'd like to ask, unless any one of us has any questions, I'd like to ask Dr. Karen, Dr. Kohe, and Sally to give their closing remarks before I welcome Dr. David Odhiambo. So Dr. Karen, you can go first, followed by Dr. Kohe, then Sally.
Thank you so much for this opportunity to have the time to talk with you, interact with you. Thank you for all the questions. So my name is Dr. Karen. This is what I love to do. I think when Marion was talking to me, I'm doing exams in the coming week, and I said it's about cervical cancer. I need to do this. So I feel like it's not because I have the knowledge. I'm ready to give it to people, and I'm ready to support people when it comes to prevention strategies, because it's good to do prevention rather than to try and manage cure. Cure is still very important, but if we can prevent these diseases, the better. Yes, I'm also from Dr. K Foundation. We thank you so much for also allowing us to participate in this. Also, and God bless you all, and keep safe. Try prevention. Thank you.
Thank you.
Thank you for, first of all, Dr. K, thank you for the invite. Thank you so much, like literally for this platform, because this is one of my passions, especially preventative medicine advocacy, because ensuring that we, as Dr. K said, prevention is so much cheaper than a cure, because look at what Sally has gone through. Before, literally, first of all, she had it that time. We did, management, rather curative processes were very limited. And nowadays, even before we remove a uterus, that's the last resort. There are so many other interventions that can be done. So you're a fighter, Sally, go continue advocating for the message of prevention and being a cervical cancer survivor. Hongera and pongezi. For me, my parting shot is, as Dr. K said, prevention is so much better than a cure. Let's keep on singing this message about vaccination. Let's advocate that young people get vaccinated. And more important, let's disseminate information in a way that it is understandable, it's packaged well, so that people don't feel like, this is a daktari thing or a medic thing, but even that mama mboga who is there, even that chokora can tell you something, because he understood what we are saying about cervical cancer. I look forward to engaging with you in future, even as we wrap up the cervical cancer month and do other awareness months. I hope that Dr. K will be calling me for these, and I've told her she must tag me along for even interviews that she does in other media stations. Thank you so much. God bless, and have a blessed evening. Thank you.
Thank you. Tuko pamoja.
Okay, so for me, I'll still put emphasis on the HPV vaccine. And we have so many other vaccines. So to fight the myths and the misconceptions, if it can be made routine, like when women give birth, there are these vaccinations that they go to, and it is like a program. Like after a certain month, you go until you get the one for is it measles or, okay, I'm old, I can't even remember which one you get last. But if it can be part of that, and information, as I say, if people have information, then these myths will just fight them. And again, for the men, I always say that there's so many TV stations. So if you can just choose to watch one, and that could help us to eliminate cervical cancer, because it spreads from one person to another. And we are told that, is it 70% is through sexual intercourse? So when we are talking to our children, let's not tell them, enda lakini usifanye tabia mbaya. Let us specify what is tabia mbaya. Because when they go to the internet, there's nothing like tabia mbaya. All they see is fun and nice stuff. And you'll be shocked that your children may know some styles that you cannot even imagine. So if we can really give the information and call a spade, because I've never known it to be a big spoon. And once again, thank you for the opportunity, and I would wish to be called any other time to speak and share my story. Have a nice evening all.
Thank you so much to our speakers for agreeing to grace this webinar. We are indebted. And now I'd like to welcome Dr. David Odhiambo to give his final closing remarks before we close.
Thank you so much, Marion. Thank you, everyone. That is from Dr. Karen, Dr. Kohe, and Sally. That was a wonderful presentation, and I believe most of the insights shared are going to be impactful to all of us. And for me, the last bit, actually, that was based on Sally's presentation. My people perish for lack of information. And most of the work that we do as Reculture Health and Social Innovation is to engage with young people and youth leaders generally, with a focus on improving access to quality healthcare and improving human capital development. So the question is, as a young person, what information and what capability do you have in yourself to help us move towards this end? And that is why we have the Youth Voices Network. We're giving you a platform where you learn with us, work with us, and actually use that trust and that privilege that you have in your local communities where people count on you and believe that you're able to give them some information that is of value. Use that information to make a difference and impact lives. And in so doing, then we'll be putting an end and eradicating cervical cancer as we hope for. So make the best of the information that you've gained, share it with others. Let's keep the conversation going as we move forward. Asanteni sana, and have a good evening.